What are the long-term data on stimulants? Are we just trading short-term gains for long-term harm? Now, there is a lot of debate about stimulants, harm, whether stimulants are being overused, ADHD being overdiagnosed, etc. On the other hand, there is the other narrative as well about being underdiagnosed, undertreated, etc. And we know that both can be true because context is where it will decide as to whether this is underdiagnosis or overdiagnosis. So this is an area where the narrative in the media, for example, and the data don't always match. So let's look at what network meta-analyses and large observational studies are telling us. So there are a few consistent messages. Stimulants, including non-stimulants such as atomoxetine, are clearly effective for short-term symptom reduction. And I've touched on this in the slides in the main talk. Long-term treated individuals tend to have better outcomes on average, lower rates of accidents, substance use, criminality, premature death, compared with people with ADHD who are unmedicated. On the risk side, however, the most consistent signals are small average increases in heart rate and blood pressure. And we've got to think about the longer term impact. We don't necessarily have studies that look at this long-term impact. Possible modest effects on linear growth in some children would seem partly reversible, and this is where the indication for drug holidays has been recommended. We don't see strong evidence of increased major cardiovascular events in otherwise healthy children and adults, though we saw in the talk that there has been some concern about the impact on cardiovascular status in young individuals. So it's something to keep an eye on from the long term. So if we think about how do we frame this in terms of treatment, untreated ADHD, we know has risks. Academic impact, accidents, substance use disorder, mood disorders, and that's substantial. The long-term medication data, it's not perfect. We need to know more, but they currently support a favorable risk-benefit ratio when it's prescribed appropriately and monitored appropriately. And one of the things that we emphasize in the talk is that medications are one pillar, if we want to think about it this way, one tool, and they work best when combined with behavioral, educational, and environmental interventions.